I'm Thomas Baldrick for Oncology.TV here at ASCO 2015. We're happy to have back with us Dr. Marcia Brose from the University of Pennsylvania. Thanks for stopping by. So let's talk about the SELECT trial of yours. What was it about?
Well, the SELECT trial was a phase 3 randomized trial between placebo and Lenvatinib for patients with radioactive iodine refractory progressing differentiated thyroid cancer. And it was a trial that was reported out last year with the primary endpoint being progression-free survival. And it was a positive trial showing a prolongation of progression-free survival of 18 months over 3.8 months. So it was a positive study. And on the basis of that, it actually has achieved FDA approval this year.
So what were the most exciting things or the highlights of the latest results?
Yeah, so the latest results that I'm presenting this year are that when there was a pre-planned analysis looking at patients who are over and under the age of 65, a pre-planned subset analysis. And when we looked at the data, it turns out that we looked at all of the primary outcome parameters, progression-free survival, overall survival, and what we found, interestingly, was that there was actually for the first time an overall survival benefit for the patients who were over 65. So this is the first time that an overall survival benefit has been seen with a kinase inhibitor in a solid tumor, especially one that had crossover. So it was an amazing result. It shows that it was quite unexpected, and it shows that there is a benefit to overall survival in this patient population.
So what might you do next with this?
Well, I think that the interesting point is a lot of providers are nervous about giving kinase inhibitor therapies to their older patients. And what we saw was that the older patients actually have a much worse survival. And when you treat them, their overall survival actually goes back to what the younger patients have. So what it actually says is that we should not withhold therapy from older patients, and that they actually get quite a benefit, if not even a better benefit sometimes than the younger patients. So that's what we'll be doing, is probably giving this drug more often to patients who are over 65, where before we might have been a little bit more nervous about trying to do that.
Very good. Congratulations on your efforts, and best of luck going forward.
Thanks.